you've tried everything at that point, and the patient is still suffering, then I would guess we have to go surgical, correct?
The question is, there are other medications out there. The benefit of those medications, other hormonal manipulations, is questionable because they're limited in how long we can use them. And some of those medications, because they can only be used short course, then yes, surgery would probably be the next step, or something like an uterine fibroid embolization.
So it does sound like what you're trying to do is every possible thing you can before you get invasive. You are really going to that nth degree to find out. You don't want to do that.
That's correct. But you know, a lot of our patients looking at this program will say, well, but I've tried this, that, on and off. We feel that the benefit of this is that the patient can choose what the intervention is. There's some of my patients that come to me and say, listen, I've tried that. I don't even want to go anything further. What I want is X. Once the risk and benefits of all those are described and the patient is informed.
UFE and a UAE, or the uterine artery embolization. What's the difference between the two?
Originally, when the fibroids were found in France, this procedure got started. And they were doing it to stop the bleeding before the patients were actually taken to surgery to do a hysterectomy. And in that time, we were basically embolizing the whole uterus and the fibroids at the same time. So in general, what happens is that for the UAE, the artery embolization, what we're doing is we're embolizing more of the uterus and the fibroids at the same time. The idea is that some conditions that arise in the uterus that are not fibroids, for example, something called adenomyosis, which is when the lining is deep in the muscle of the uterus, can be treated, and you're treating that with the actual embolization of the artery. But they're very, very similar. Sometimes they can even be used interchangeably.